So would all of these disputes take place if we had a fully privatised healthcare system? So here to discuss this is Christopher Snowdon from the Institute of Economic Affairs. We've got Benjamin Loughnane, a research fellow at the Bow Group, and GP Dr Ken Aswani. Gentlemen, thank you for joining me. This is a conversation which has been had for several decades now. Christopher Snowdon, let me come to you first. Why are we in this dreadful position as we face another Christmas with an NHS in crisis?
Well, partially because of the strikes, as you mentioned, which have been caused by inflation and our inability to keep up pay in real terms, partly because of the COVID backlog. But also, these are not new problems. We have a winter crisis in this country every single year. Other countries generally do not. We are an exception. We're exceptionally bad. And I think the reason for that is the NHS is a vast government monopoly. And like all vast government monopolies, it's badly run and inefficient. So
should it just be entirely privatised? What does that look like to you, Chris?
Well, I'd like it to look more like Holland or France or Spain or, most of the rest of the world, where the government doesn't actually own and run all the hospitals. It just makes sure that people can get healthcare. So there's nothing special about universal healthcare free at the point of use. The vast majority of developed countries have that, but what they don't have is a government actually owning and running the system. There's no reason why the hospitals can't be privately run, as GP surgeries currently are, by the way. And it's also good for staff because, you look at this current situation, nurses demanding 19% pay rise, going on strike. In a private system, if they're not happy with the terms with their employer, they go to another hospital, they go to another private healthcare provider. You have competition. So the competition works for the staff, but also, of course, most of all, it works for the customer or the patient.
Let me come to you then, Dr Ken Aswani. You're a GP. Christopher makes it all sound incredibly commonsensical. What do you think would be lost if we had that system?
Yeah, I mean, there's always a sort of a debate about, whether we'd be better off with a privatised health system. But I think the health system that we've got, certainly the NHS, is admired sort of all over the world. And the costs of running a health service, it is expensive. There's technology, increased sort of older population, and people are living longer. But all the research I've seen is the most cost-effective way of running a health service. There's lots of dangers of trying to privatise a health service. One of it is that, we can increase sort of inequalities. So, the ones that can afford it get the service, but obviously not so much the ones that are not able to. The other aspect of it is we do have a number of national programs, such as immunisation programs and sort of so on, that actually keep most of the population quite healthy. So I think looking at the evidence, I think, sort of the NHS free at the point of use is, I think, the most cost-effective way of running it. I'm sure we could always improve and transform, but I think that has to be a fundamental tenet of, how we move forward and how we try and sort of reform and get more effective at what we do.
Benjamin, if I can come to you, by any definition, it isn't really working at the moment for most people. When the NHS works, it is the greatest in the world and it is incredible, really. And it does feel a bit anachronistic that we still have a system which will, treat anybody walking through the door at no cost to themselves. What's the solution from your point of view?
Well, we've seen there's a vast amount of waste and inefficiency within the NHS, and especially over the past couple of years when we had lockdown, for example, and people were missing cancer screenings because it basically became the COVID health service rather than a national health service actually dealing with all a broad range of all ailments. It really became very focused on one thing. And that's one of the pitfalls when you have a nationalised service, when you have something which isn't private, where there's no competition, where people can't say, if you aren't providing the services that are required, we can go elsewhere. You remove that choice, and it makes it a lot harder for people to then hold the service to account. But there is a middle way. You can keep the service free at the point of delivery, whilst also having a level of privatisation within how those contracts are bidded on and who provides them. And if you were to keep it so that it was still free at the point of delivery, but have private healthcare providers providing those services, then there'd be more of a profit incentive, there'd be more competition, you'd get better value for money, you'd provide a better service for the taxpayer, and it wouldn't harm the fact that it's free for all people who need it.
Are we getting value for money, Christopher, do you think, in any way?
No, the NHS is a huge money pit. I mean, the idea that it's chronically underfunded is absolutely untrue. You know, in the past, it has had a bit less than the OECD or the EU average, which it should do, by the way. If it's so efficient, it should require less money. Now it's getting way above the OECD average. It's getting a huge amount. It's obviously got a massive boost during COVID, but it's not looking like it's going to be getting much less in the future. In fact, it's just going to keep going up. Jeremy Hunt's already announced another £6 billion for that. It's endless, you know, and who knows what the money's spent on. It certainly doesn't seem to be going on hospital beds, doctors and nurses. We have far fewer doctors and far fewer hospital beds than most countries, and that's part of the reason you have this problem with bed blocking and ambulances not able to drop people off at the hospital. The whole thing's a complete mess, and it's not admired around the world. Most people around the world have no idea what the NHS is, and when foreign visitors come here or move here, they're amazed at the pride that we have in this below average healthcare system, and there's a staggered that anybody would be impressed at being able to see a doctor on the same day, for example. So no, it's not admired, and insofar as we admire it in Britain, it's largely because we're so parochial. We haven't looked around the rest of the world, apart from America, which is the only country anybody seems to be familiar with when it comes to healthcare.
Ken, do you think that we've all just lowered our expectations dramatically over the last 2 years when it comes to the NHS? As Chris was saying there, you can't necessarily, almost nobody can get a GP appointment on the same day anymore. You've got extraordinary waiting times at A&E. We're seeing ambulance drivers about to go on strike when we've already got extraordinary wait times for paramedics. Is it time to just say, you know what, it's in intensive care, but we're going to do a DNR on it any minute now?
Yeah, I mean, I think nobody would sort of argue with the challenges of the NHS, and I think they've been described really well. I think it's sort of the areas we can reform. So, for example, if it's free at the point of use, and, you know, sort of, for example, sort of private hospitals and sort of so on, well, that happens at the moment. I mean, we do refer patients to sort of private hospitals or other services, and they're part of the mix. And in a sense, you know, they do compete at that level. There are sort of changes afoot on how we look after, because a lot of patients that get admitted to hospital are often the frail elderly. And actually, if we have more effective, say, multidisciplinary team working so we can keep patients at home, that is both cost effective but ultimately better for the patient as well. There are lots of initiatives, say for long-term conditions, diabetes, that actually through lifestyle measures and patients are supported to look after themselves, that can be really, really cost effective. So it's a series of mechanisms that we get more efficient and transform the way we work. And we do need to do that because, you know, it is a precious resource. But I think we've got to be careful of trying to think there's kind of one solution, really. And sometimes privatising fits in that. We think it's a solution. I don't think it's a solution. I think we need to sort of tackle it in different ways, but get the benefits. But yes, we do need sort of, you know, much better access. And actually, we don't need sort of heavy sort of challenges that we've got at the moment ongoing. We do need to resolve those.
Benjamin, if I can give the last word to you as a research fellow, you look into your crystal ball. What does the future look like for the NHS, and what sort of timescale would you attach to that?
Well, I think we all agree that the NHS needs reform. We might not agree on what reform it needs or how, but we do agree that there is areas of waste which need to be solved. But the problem is, the moment you've got a Conservative government turning around saying we're going to reform the NHS, it's like a sacred cow. People go, oh no, don't touch it. You can't do anything to change it at all. But there need to be changes made. If you really love the NHS and you want it to be a successful service for all people in this country, you need to make reforms. You need to adapt to the times. You need to change. You need to get rid of the waste and trim the fat. And the problem is, when you have a government which is kowtow so easily to the left-wing press and refuse to do anything that might get them in hot water with The Guardian, they're never going to have the gumption to actually turn around and do this. So I hope that I'm wrong.
And of course,
Yeah.
gentlemen, and of course, it is a very hot potato when it comes to the electorate and voting intentions, is it not? And I think that's probably why successive governments have dared not go there. Thank you so much to all three of you.